The last couple of years have been incredibly hard for children and young people. They've lived through the COVID pandemic and lockdowns and now the cost of living crisis. BBC Children in Need provides funding to charities here in the West which help them. Charities like Developing Health and Independence. It runs Project 28, which helps children and young people with drug and alcohol problems. This 18-year-old bravely shared their story, but not using their real name.
I hadn't really tried them before, but I'd seen all my friends do it, and I thought it was pretty safe and pretty okay. So I took a pinger on Halloween a couple of years ago. Thought it'd be fun, whatever. Yeah, that's how it started really. In lockdown, I was just bored, I had nothing to do. The only people available were dealers, so I was doing a lot of MDMA, ket and everything. And then it became a dependency because I'd just been doing it so much.
G is a young person that has been struggling with their drug and alcohol use for some time. G was using quite a lot of different substances to cope with kind of difficult emotions, undiagnosed mental health needs. There was also other concerns about possible risks of exploitation.
It was only really recently that I saw I had a problem with it.
Project 28 is a young person's drug and alcohol service, and we cover Bath and North East Somerset. And our job is to provide education, harm reduction and safety advice. Our first step is to really understand that young person and help them have that autonomy over what goals they want to set. Can you tell us a little bit more then about the impact that your kind of drug use was having on your wider life?
Well, my relationship with my mum was completely ruined. Same with my dad. And those are kind of the two people who you know will always be there for you. And when they're not, it's kind of a scary situation. I failed my GCSE maths because I wouldn't go in. I was just out doing drugs instead. You lose so many good friends and you can't get them back after that, after they've seen you go down that path. Because I was just such a horrible person. Either I was high or on a come down.
For a lot of our young people, it could be mental health related, so they're using drugs or alcohol to cope with difficult thoughts, feelings and emotions.
I took an accidental overdose and I went to hospital. I kind of saw for the first time that my entire life had just been kind of thrown up in the air. So I realised I had a problem then.
And how are you now?
I'm very good now. They're there to listen and not judge. And I didn't really have a place for that before, so Project helped me there.
They're doing really well now, I'm really pleased to say. They've no longer got a drug dependence, which is really brilliant, and it was a massive achievement. They've also really excitedly just started a nursing traineeship with the view to obviously go into nursing.
I'm back on track with education and everything, so by the help that Project gave me with drugs, it helped rebuild relationships. I wouldn't be off the drugs without Project, I don't think. So being off the drugs is what's made my life better.
And your BBC local radio presenter